What is dysphagia, and how does it affect stroke patients? Imagine trying to swallow food or liquids and feeling like it gets stuck or goes down the wrong way. That's what people with dysphagia experience. Dysphagia is the medical term for difficulty swallowing, which can involve trouble moving food or liquids safely from the mouth through the throat and into the stomach. It can be mild, like a little discomfort, or severe enough that swallowing becomes impossible. After a stroke, many patients develop dysphagia because the stroke can damage the brain areas that control the muscles and nerves involved in swallowing. Swallowing is a complex process that requires coordination between muscles in the mouth, throat, and esophagus. When a stroke affects these areas, it can weaken or paralyze these muscles or disrupt the neurological signals needed to coordinate swallowing. This can lead to two main types of dysphagia. Oropharyngeal dysphagia makes it hard to start swallowing or move food from the mouth to the throat. Esophageal dysphagia involves problems moving food down the esophagus into the stomach. The consequences of dysphagia in stroke patients can be serious. One major risk is aspiration, where food or liquids accidentally enter the airway instead of the lungs. This can cause aspiration pneumonia, a lung infection that is a common complication after stroke and can be life-threatening. Dysphagia can also lead to malnutrition and dehydration because patients may avoid eating or drinking due to difficulty swallowing. This can slow down recovery and weaken the patient's overall health. Additionally, impaired swallowing increases the risk of choking or airway obstruction, which can be dangerous during meals. Signs that a stroke patient might have dysphagia include coughing or choking during eating or drinking, feeling like food is sticking in the throat, drooling, hoarseness, or repeated chest infections. Because early detection is crucial, healthcare teams often perform swallowing assessments soon after a stroke. These assessments are usually done by speech-language pathologists using bedside evaluations and specialized tests like videofluoroscopic swallow studies or fiberoptic endoscopic evaluation of swallowing. These tests help determine how severe the swallowing problem is and what specific areas are affected. Managing dysphagia involves several strategies. Speech therapists work with patients on swallowing exercises to strengthen muscles and improve coordination. Diet modifications are common, such as changing the texture of foods and thickening liquids to make swallowing safer. In severe cases, patients might need temporary or long-term feeding tubes to ensure they receive enough nutrition and hydration while protecting their airway from aspiration. In summary, dysphagia is a common complication after stroke that affects how people swallow. It can cause serious issues like pneumonia, malnutrition, and choking. Early diagnosis and personalized management are essential to help stroke patients recover safely and maintain their quality of life. If you or someone you know has experienced a stroke, it's important to work closely with healthcare professionals to assess and treat swallowing difficulties properly.